Hello, my name is Dr. Emil Euaparadorn. I'm a physical therapist at Aspire, New York City. Today we'll be discussing how to do arch control exercises. Arch control exercises are vital for foundational control of the whole entire body. So I'll demonstrate here on Dwayne. Right now his arches are not so bad, but I'm going to exaggerate and make his arch drop. And then immediately you see a huge change up the whole entire chain. You see the knee will cave in, his hip will drop, and by his hip dropping, his whole body will lean this way. He will immediately tilt this way to compensate and therefore stretching out his contents on his back. By doing this motion here and by dropping your arches or pronating your arches, you will see that you're overstretching your arch here and you could get plantar fasciitis. You're overstretching your knee here, you get MCL sprains or medial meniscal tears. You're stretching your hip over here, you get hip bursitis. This will lead to a tight ITB because the ITB is constantly being stretched and it's trying to bring it back into position. Your hip is dropping over here and causing unnatural stress to your lower back, especially to the SI joint on the right side. So all this happens by simply not having complete arch control over here. So it's vital that we understand how to get control over here. But when we do this, it's not simply of just doing some arch exercises, it's by using arch muscles and knee muscles and hip muscles together. So let's learn how to do the exercises. So it's easiest to learn in sitting, so please take a seat over here. And then the key is to lift this arch up. I know it sounds very hard to do, but it's actually quite doable. Immediately when I ask somebody to lift the arch up, they turn the foot in like this. But by doing this over here, you can see that you can actually sprain your ankle this way. So to make sure you don't lift your whole ankle in such a manner, you're going to do a few things to prevent that. So the first thing is that I want your toes to lift up like this. That will avoid toe curling. This is your knuckle, right? That's the second thing. On number two, you're going to keep that down. So number one goes up, number two goes down, and then you raise your arch up ever so slightly as you maintain number one and two, right? So in this case here, Dwayne has a hard time here, which is very natural because it's hard. How do I lift the arch up and maintain this down? So sometimes it's easier if you actually press down here, okay, on number two, okay? One is up, two is down, three is up here, and it's easy to do to get this arch up by doing number four by rotating your knee outward slightly. Rotating, not tilting, but actually a rotation. Okay? This rotation, in conjunction with your arch muscles, help lift up your arch. Okay? Simply put, if this knee were to rotate inward here, your arch would drop down. So by doing this rotation here, you would get that. So number one up, two down, three up, four rotated. And your first goal is to hold this for 2 minutes. Once you can do that for 2 minutes, then try and stand it with some weight up. So can you please stand up, Dwayne? Okay. And then once again, activate number 1, 2, 3, and 4. Toes up, 2 down, 3 up, 4. Rotate out slightly and maintain the arch. Once you do this for 2 minutes, can you maintain this and squat down? Okay. When you squat, make sure your knees don't go past your toes, as if you're looking down, and make sure you bend at the hip, and you can go up and down. So squat, okay? And when you squat, now really make sure your arch doesn't drop, and come back up. Squat again. Good. And then on the way up, squat down again. Take your push into your heels, and squeeze your tush, move your pelvis forward. A slight pelvic thrust. Really engage all those extensor muscles. And you don't overcompensate with only your quadriceps. So once again, when you come up, push through your heels, squeeze the tush, pelvis thrust slightly forward, and maintaining the arch. Your goal is to do this for 2 minutes, and once you can do that, there's a series of progressions which we'll show in the next video. But once again, the key is a long time in 2 minutes. 2 minutes will makes us concentrate on the quality versus the quantity. That is why we go with 2 minutes, and once you can get that adequately, we will move to the next exercise.